Hi, this is Dr. Makani. Today we'll be demonstrating to you the Tejco Flawless Gel-based 50% peel application on a patient. The glycolic peel is an exfoliant. It's used for acne, photopigmentation and a lot of other disorders. The Tejco Flawless Glycolic Gel-based peel is unique in the sense that it is gel-based. It's been tested at an FDA-approved lab for being within the irritation index, and hence there is less irritation to the patient on application, which makes it extremely comfortable for it to use. Also, it is suitable for all skin types, especially the Asian skin type. As you know, it's already being used by the top dermatologists in the country, and I strongly recommend its usage. Thank you. Hi, we'll be demonstrating on how the Tejco Flawless Glycolic Gel-based peel 50% is to be applied with the ideal strokes. So we've got a patient here who's peel ready. She's basically cleansed and moisturized. Now I'll be taking in the peel and showing you on how to apply it with the strokes. First, we basically start with the forehead. We have to see that it's evenly applied. We then move on to the zygoma and the cheek. We finish the right and left side of each area. We then move on to the chin. Then to the upper lip. Then the nose. And then to the eyelids. We let the peel stay on for 10 minutes and then neutralize it with cold water. Thank you.
Hi, I'm Dr. Nigarish Khan from Cosmeticure Clinic. So today we are going to talk about gel-based peels, which we usually use in our daily practice. I would specifically talk about Tejco's gel-based peels. The reason why I will more emphasize on gel-based peels are because they are the safe, they are very mild, and per se the side effects, the very superficial, I would say temporary side effects which we usually experience after peeling is none, or I would say it's not there in gel-based peels, and it is the safest. Today I'm going to talk about chemical peels, and chemical peels are treatment usually used for face and body, where we smoothen or we slug off the dead skin, and the skin which regenerates is flawless. The texture of the skin is more smoother, and the wrinkle as compared to the older one is more, it comparatively is less. Glycolic acid is a very mild or a beneficial form of acid which is made from sugarcane. It's a alpha hydroxy acid, and I would compare glycolic acid with other alpha hydroxy acid. It's more safe, it's more beneficial, and the molecules of glycolic acid is very small, so they go deep into the skin, and they leads to a formation of new collagen, and that's why we have a rejuvenated skin which is good in, which is more smooth, which is the color improves, and the fine wrinkles also improve, and the tone of the skin also improves. Now the basic indication for going for a glycolic acid gel-based peel is for hyperpigmentation, for acne scars, for oily skin, for open pores, usually for uneven skin tone, and for under eyes, as well as for I could say fine wrinkles, not usually the deeper wrinkles, I could say the fine wrinkles. The Flawless brand of Tejco, there is different concentration, that's 30, 50 and 70. Why 30? 30 is usually for superficial peeling, okay, and fine wrinkles. and uneven skin tone, whereas for 50% concentration is usual for moderate peeling, I could say the deep scars, and 70% is for deeper penetration of the peel, okay, for deeper scarring as well as very tanned skin or hyperpigmentation skin, or I could say open pores and uneven skin tones. Now I'll be taking you for a live demo of peel, which I'll be using flawless product from Tejco, 30% glycolic gel based peel. Now we'll be starting the procedure of flawless product by Tejco. But before doing it, I would like to explain one thing, that there are certain things which a patient should be knowing it before going for a peeling procedure. That's called pre-peel care. First thing is, the patient is not supposed to go for any kind of a parlor procedure like facial, threading or cleanup. Wherein in case of male, the male is not supposed to shave a day prior or on the day of treatment. So I'll be starting off with the treatment with my patient right now. The first thing which I'm going to do is I'm going to do a cleansing thing, where I'm going to clean the entire face, where I'm going to break down the acid mantle, so that when I apply the gel base peel, so there is proper penetration of the peel, right? This is the cleansing milk which I'm using it, wherein I'll be cleaning the entire face with it, sides of the corners of the mouth, the nose, below the eye, above the eyes, forehead. Now with the help of the earbud, I will be applying the petroleum jelly, all the sensitive area of the patient, like corners of the lips, the nasal fold, the angle of the eyes, because these areas are very sensitive, prone area. While doing the peeling, they might get irritated. I'll be using the flawless product by Tejco, which is glycolic acid gel base peel. So here I'm going to start off with the painting of the entire face with just one single stroke. There should not be overlapping of the stroke. It should be from center outward. Ingredients. Little bit of prickling sensation the patient might feel during the procedure. That's normal and that's really obvious, but that will be there for a temporary period. And if it's not bearable, you're supposed to dip a cotton in cold water and you can mop. You can just mop over the area where the patient is feeling severe burning sensation. So she's explaining it here. So I will just mop it and that will neutralize the peel at that particular area. I will keep this peel for 5 minutes because this is the first session of this patient. So I will keep it for 5 minutes and after 5 minutes I will neutralize it with plain cold water. 5 minutes is the time period for keeping the peel, gel based peel. Now we'll be cleaning it with cold water. That is, I will be neutralizing the effect of the peel. Okay. Now I'm going to clean the area, but I'm supposed to clean it very gently. I'm not supposed to be harsh because it might burn a lot. I'm neutralizing the effect of the peel. I'm going to repeat this till the patient feels better. Supposed to ask the patient if the patient is feeling comfortable or still the patient is having any burning sensation anywhere. Are you having any burning sensation anywhere?
No, I don't think so.
You're
No.
perfectly alright?
Yeah.
You're supposed to pat dry the entire face when you're experiencing some pain. I mean, any burning sensation? No?
No.
So, supposed to pat dry the entire face. After this, the peeling procedure is over, and according to the skin tone of the patient, we're supposed to apply a sunscreen lotion because now the skin is actually being peeled and the peeling process will be going on for a day or two. So the skin has to be protected from the sun. So we have to apply an SPF. For her skin tone, I will rather recommend SPF 30, which I'll be applying it all over the face, and she has to reapply it after every 4 hours.